This is just functional to see if the both scapulas has the same range of motion or moves the same, okay? So put both arms in front, lift all the way up. Go down. See? Set up. Okay? So this one, even just like this, you can see that this one is popped back just a little bit. Okay? So this would be quand tu fais des push-ups, ça fait mal.
When you push up, it's a landmine everywhere.
That's like
It's almost like scapular winging, but he's strong. Usually scapular winging, like there's no strength at all. He has some, but I think it's more of a, like to protect the shoulder more than anything else. Okay, so it's like he's used to it, but when he can do push-ups. That's the problem. Okay, so every time it hurts, so we know that this is unstable there. So we would have to work with doing the pulley like this, and then bring in the shoulder back. Bring the shoulder back with the pulley, and then attach the pulley to the elbow, and then bring it back like this. So this is one way of working like the subscap, but also so to make sure that this doesn't move up when he tries to do a push-up. Now, same thing but on sides. So, commence à table, mettons les deux bras droits, même si t'es comme ça ici. Yeah. I'll go up, all the way up, and then down. See, this one goes down faster than this one. So those are a few things that you can look at, and then when you reevaluate and then you do the program after, that's when you see progress. Like this is more mobile, greater range of motion. He only has issues on this shoulder for range of motion, not this one. So again, like doing pull-ups and stuff like that, we have to be careful. Like lat pull down, it's safer because you can control, or you do more, which we do is one arm at a time. Okay, so always include one of those to make sure that there is no, or you try to recover the strength discrepancy between both. Stand up. Je vais voir de quoi des fois debout, c'est une autre affaire. Ouais. Même affaire. Ok, fait que lève. Straight up. Okay, go down. See, this, now it's a bit better. Okay, just because he's standing up. But when he was down, this is stretch, he was leaning a bit forward. So it changes the whole mechanic when you look at it this way. Okay, fais la même chose en haut. Then go back down. This one's better. This is okay. So the only one we can see is that it's mostly scapular winging. So you do all those tests just to confirm a few things. Okay, but anyways, like that's for her because she's gonna treat like different part, but very deep tissue and like better for ART and stuff like that. Like for us, as soon as I saw this shoulder, I was like, okay, no, you do one arm at a time. We work on it. We do external rotators. We want to keep this shoulder down and make sure that it doesn't lift up or changes the mechanic when we do it. Okay. That's it.
Your chair was electric.
This one's limited, but this would be because this one is maybe tighter or he's limited there when he turns. So that's when we have to look at like more, she's gonna see if by manual treatment or to see if there's some tension or if there's some stiffness there. That's what she has to do. Yeah. Comment c'est? So, then, now shoulder, then lift your arm up and then try to reach and go touch as far down your shoulder blade or even your column down. Okay? So you see that's there. Now base ce bras-là. Now switch the other arm. Do the same thing. About the same. Now la même affaire, mais là reach back down. Up. Yeah, about there. Now do the same thing with the other side. Bit better, but it's not bad. Okay, it's pas la peine. Now, il y avait celle-là, celle-là. One simple test also is sometimes it's the chest, small pec that is so lie down on your back. This is really easy. Cross your fingers behind your head and let go. Okay, so what you'll see, he's not tight, but what sometimes you can see one down and the other one is up because there's one strength discrepancy or tightness on one side. Okay, so she would have to release that. Okay, now for the test, go on your stomach. For the test, what I like to do is to see according to the table. Okay, so I want to go up. So you lift the elbow as the same height as the, then as far as you can until you feel something. So now you feel something there, but he's a bit higher than the table, maybe 10, 20 degrees, okay? There, okay, so that's not bad. Again, you want to look at if there's one side tighter than the other, okay? So this one, this one you can't even reach like the table because it's already painful. Same thing, this is really limited there. So this would be tightness there, or it could come from the shoulder, but I think it's more inside like the shoulder blade that he has to do, because I'm pretty sure you can put your hand in the back there, okay? Lift your elbow. Okay, so strength is there, but range is limited. So it doesn't come from there. That's when you see that it's in the shoulder. So if he wouldn't be able to touch in the back, that would be in the shoulder blade or more the subscap, the issue. But now we know it's really like inside the shoulder. For neck, sit down. So for neck, what you want to do, if you want to do muscle test, turn the head there, down, okay, push up. So now that's strength from extended position, or you lift, keep it there, I'm pushing down. He's strong there. It's rare I've seen like a weak neck, except if it's like an old lady that's not good. So like this, same thing, push, that's good. Now down, push back, strength is there, okay? So there's no, I like to sometimes test the muscle in an extended or contracted position. Depends on the issue where he's hurt. That's the only issue that I would see. Just want to make sure I don't forget something.